Hi, this is Dr. Barry Marks, chiropractor in Orange, California. I want to explain to you the process that you'll go through when you first come to my office as a new patient. First, we'll gather information from you. Hopefully you've gotten your patient intake forms online and you filled them out before you come in. You'll also need to gather up all your lab tests that you've had done in the past. Any labs that you've had done in the last 12 months, I want to take a look at. If you've had any MRIs or if you've had other x-rays, please bring those with you on your first visit as well. Once you enter my office, we'll sit down and we'll chat for a while. I'll ask you a couple of key questions about your condition. We'll also go over some questionnaires that I'll have you fill out that'll tell me about the neurologic and metabolic function of your body. It'll tell me where there's key areas that are not functioning correctly, so I can zoom my exam into exact areas that I need to look at. We'll then go through an in-depth physical examination. I'm going to check you neurologically from head to toe. You'll never be asked to undress or do anything uncomfortable, but we're going to have you bend and twist and lift, and we're going to have you move your fingers in different directions. I'm going to check your eyes, check your reflexes, check your blood pressure, your oxygen level, different things like that. We'll then take a couple of x-rays in most cases, and we'll also do a couple of painless computer tests that'll tell me about things like muscle tension and also your range of motion. Once I've gathered all that information, then you'll go home. I'll sift through your lab reports and I'll score them according to a grid that I've devised. I'll look at your exam results and I'll put together a complete report for you. On your next visit, you'll sit down with me and I'll go over the report with you. Line by line, I'll explain to you exactly what your condition consists of, what the severity is, and then what your options are as far as treatment goes. I'll also tell you what the long-term prospects for you are. Once we've arrived at that conclusion and we've done our report, then it's up to you. You must then decide what type of treatments you want. I can't tell you what to do, and I don't force any patients to take any treatments. I'll lay it out for you simply on paper to tell you exactly what's going to be needed. I'll also tell you the cost of everything and whether or not insurance will cover. I'll tell you this, insurance will never cover everything in our office. That's just how insurance works. But we will make sure that we maximize your insurance and get them to pay for as much of our care as possible. I also want you to know that almost anybody with a job can afford this type of treatment. You can expect that a payment plan could cost you $200 a month. So that'll be no surprise when you come in. If you're serious and you have a condition that I can treat, then you'll know that that's not a barrier for you, that that's the level of commitment that it would take to undergo our care. So fill out the paperwork when you get it, make sure it's complete, gather up all your other records from your other doctors, and bring them on your first visit. And I look forward to seeing you then. Bye-bye.